Assalamu alaikum, dear doctors. I welcome all of you in this class. Just read this scenario and inshallah we will start in 1 minute. Bismillahirrahmanirrahim. Dr. Faiza, you are here.
Yes, Dr. Mubasshra. Assalamu alaikum.
Wa alaikum salam. And is my voice audible?
Yes, your voice is clear.
And the screen is also visible.
Yes, it's visible.
Okay. So have you read the scenario?
Yes, I have read it.
Okay, your time starts now.
Okay. Hello and good morning.
Good morning.
I am Dr. Bilal, one of the doctors from the medical ward. May I confirm you're Mr. John, 38 years old male?
Yes, doctor.
Okay, Mr. John, I hope you're comfortable in this room.
Yes.
Okay, Mr. John, I'm here to discuss about your health condition, and I would be more than happy to answer any of the questions and concerns that you might have.
Okay.
Mr. John, may I ask if you need anybody from your friends or relatives to be in this room with you?
No, doctor.
Okay. Mr. John, so can you tell me what is your idea and your understanding of your health condition so far?
Actually, doctor, I have been suffering from some lumps and bumps in my neck, especially on the right side, as well as fever and fatigue for the last 6 weeks. I went to my GP and he prescribed me 1 week course of antibiotics. But this problem is still there, so he referred me to your department. And last week I came here and your senior doctor ordered some tests. And today I'm here to get the results.
Okay, Mr. John, I appreciate your knowledge about your condition. And yes, I'm here with the results. I have the results of your investigations. But Mr. John, I'm sorry to tell you that I don't have a very good news for you today.
So, what do you mean, doctor?
Actually, Mr. John, you are suffering, your tests show that you are suffering from an infection which is called as human immunodeficiency virus infection, that is the HIV infection.
Oh God, doctor, are you serious?
Yes, Mr. John, I am afraid that your test reports have come and they suggest this infection.
Doctor, is it confirmed? I mean, can you confirm it with some other test? I mean, I'm not sure. I'm in a shock that how is it possible?
I can appreciate your concern, and it is very understandable that it is a shocking news for you. But actually, it is your report, and we are quite sure that the report is correct, and it shows that you are suffering from HIV infection. Mr. John, do you want me to tell you more about it?
Yes, doctor, please continue.
Okay, so Mr. John, these days HIV infection is quite treatable, and there are a lot of medical medications available and treatment options available for this. And previously, like it was considered that it is such a disease which decreases the life expectancy, but nowadays people with HIV live quite near to normal life because of the advanced medications available for this. So, yes, it is a serious condition. However, I must assure you that we are here to help you, and there are a lot of options available at this time. Are you getting my point, Mr. John?
Yes, doctor.
Okay, so Mr. John, do you have any concerns?
Yes, doctor, I'm quite anxious at this moment and I am in a state of shock. And I am not sure from where I get this HIV. I just believe that it is not possible.
Oh, Mr. John, I appreciate your concern, and your anxiousness is quite understandable. If you want, I you can have a glass of water, and we can discuss after you. You must calm down because we are here to help you, and there are so many options available for this condition. And actually, these condition can be transmitted not just by sexual contact. There are a number of other ways possible, like any for example, any minor surgery, like any surgery on the tooth, any tattooing, or any other procedure which involves sharp instruments and blades or something like that. So there are possibilities of catching the infection through those routes as well.
Hmm.
Are you getting my point, Mr. John?
Yes, doctor. Actually, I'm anxious that whether I will be able to continue my job as I have to support my wife as well as my kids.
Yes, I understand, Mr. John. What kind of job do you do, Mr. John?
Doctor, I am a driver.
Okay, so Mr. John, with the driving, there is no such issue as such where you can put other people or yourself at risk. And currently, you are facing some symptoms. However, I believe that with the proper treatment, they can be controlled, and we would immediately refer you to infectious disease department, and they will start they will run some more tests actually, first to confirm at which stage your disease is, and then they will start appropriate treatment. Is that all right?
Okay, doctor. Is it AIDS?
At this time, I cannot say that whether this is AIDS or not, because you need some more tests to confirm. Actually, you will need some blood tests where your blood counts would be measured. What is the count of your bloods? Whether it has infected you so badly that it is suppressing your defense system and leading to some other infections, which is actually AIDS. Every HIV infection cannot be attributed to AIDS, because AIDS is a serious form of HIV infection where the defense system has been so much depressed that you are prone to carry serious infections from minor exposure. So at this time I cannot say. However, after some more investigations, we will be able to tell you about it. Is that okay, Mr. John?
Okay, doctor.
So, Mr. John, I have to tell you a few things that, considering the diagnosis, it is your obligation to tell your spouse about this diagnosis, so that we can test her as well.
But
Because
doctor, it's my request to you that please don't inform my wife about this.
I appreciate your concern, Mr. John, but actually, it is not only our responsibility, but it is also your responsibility, as well as a ethical as well as legal obligation to inform your wife, because it is not only unsafe for you as well as her. Her health is also dependent on this. And if she gets tested and gets treated, if she is found to be positive, then it would be better for the both of you. Are you getting my point, Mr. John?
Yes, doctor. 2 minutes are
Mr.
left.
Mr. John, may I ask, have you been in any other in any contact with any sexual contact with any other person other than your wife?
No, doctor.
Okay, so Mr. John, I must tell that you should bring your wife and we can do some tests on her. And also, you should take some preventive measures. You should do protected sexual contact with your wife, as well as take some other protective measures like avoiding the use of any sharp objects and like sharing of for example any sharp objects like nail cutters, even combs at home, and or any shaving instruments or anything like that. So you should take care and to prevent other people at your home. Is that all right?
Okay, doctor.
Okay, and it is advisable that you also inform your GP about this.
Hmm.
Mr. John, may I ask you some more questions? Do you smoke, Mr. John?
No.
Okay, and any alcohol intake
No.
or use of any recreational drugs?
No.
Okay, that's good to know. And are you do you financially and socially well supported at home?
Yes, doctor.
Okay, that's good to know. However, if you still need any kind of support, we are here to help you. We have a lot of help available. I am going to give you some leaflets and brochures where you can read more about this infection as well as the protective measures that you can take for yourself and for your family, and also about the management options available. Is that all right?
Okay, doctor.
Okay, thank you, Mr. John. We will follow you up soon and in the infectious disease department. Is that all right?
Okay, doctor. Time is over.
Okay, thank you, Mr. John.
Welcome. Okay, Dr. Faiza, it is a good attempt, I would say. Just a few things I want to tell you here. For example, right from the start, you take a very good beginning. This is the beginning basically, which is required by the PACES examiners. But when you start, here there is a scenario of HIV, which is a quite sensitive topic. So here you don't need to ask that do you want anyone else to be in this meeting today, because it is a matter of confidentiality. Okay, so in
Okay,
such scenarios we don't ask, we just ask in those scenarios, for example, where we have to break a bad news regarding, for example, a carcinoma, or we have to break the bad news of a patient who has some terminal illness, like, for example, chronic illness which is not treatable, like motor neuron disease or multiple sclerosis. But in such scenarios where there is a chance that you have to talk about some sensitive topics, here you will not ask that do you need anyone to be in this meeting today. Okay, but instead of this sentence you will say that whatever we will speak today will be kept confidential. Okay,
okay,
because
okay.
here you have to tell him that you are HIV positive. And another thing is that keep on asking concerns, because such scenarios have concerns, lots of concern. At least ask this question that do you have any concern whenever they say that 2 minutes are left. Always remember this, that this last 2 minutes prompt the examiner gave you, not only social history, instead you have to ask this question as well. For example, here in this case there was a concern that whether my kids can also catch HIV from me just by using the household utensils or like this. So always ask this question, that do you have any concern, because these concerns have been written by the examiner, and they will hand over this page to the surrogate, so they know that we have given him 4 or 5 concerns. Okay, and another thing is that when the surrogate asks from you that is it confirmed, or do you need some other test, because I cannot catch it. Okay, you manage it nicely, but instead you can add one sentence elsewhere, that we disclose the information or the results only once they are confirmed. Okay, so this would be a better sentence. And another thing, try to avoid this word I understand. Just say I see, I can see. Okay, I can see this is a very difficult time for you, and rest you answer all the concerns quite well. Just one thing is that uh, don't be judgmental. For example, when he said, I'm not a smoker, I'm not alcoholic, and I don't use any IV drugs. So, okay. But no need to say, okay, it is good to know. Because the PACES examiner, especially the foreigners, they don't like this to be judgmental. Okay, so just take the information and just say, okay, next question. And another thing is that you have to inform the GP. I mean the doctor, because GP has given you a letter along with this. For example, they will not give you the whole letter. Instead, they will just give you the information that the GP has referred you this case after having these symptoms and giving antibiotic course or something like that. So it is basically yes that he will also inform the GP, but you will say that we will also inform the GP so that he can give you better healthcare facilities. Rest your all of the things are good. When the surrogate asks from you that is it AIDS, you can just give a diplomatic answer instead of yes or no. That AIDS is basically a more severe spectrum of HIV, and it involves different parts of the body system, and we will do some further test about it, and then we will be in a better position to tell you that whether it is AIDS or not. But currently, according to your situation, it is not likely. Okay. So,
Okay.
yes, I'll just start this scenario again. For example, before we proceed, the most important thing here that whenever we do any communication case, it is always divided into three parts: opening, then the body, and then the ending. Opening involves introduction. After that introduction, for example, first of all you will do the greeting, then you will do introduction. After that you will check the identity of the patient, then you will build a repo, then you will set the agenda, then you will take the insight of the patient. This part matters a lot because the examiner will come to know that how much prepared this candidate is. This part of you is absolutely good, it is excellent. Just one point, that here you will say that your confidentiality will be maintained. Whatever we will talk about today will be kept confidential. And no need to ask that do you want anyone else from your family or friends to be in this meeting today. Okay, after this opening comes the body. That is the explanation. After asking any specific concern, then you will start explanation, which is the basically the main task which you have to perform in any scenario. And after that comes the ending. For example, in ending, here you will ask about social history if it is applicable, because in some scenarios it happens that there is so much information which you have to give to the surrogate that you cannot perform this step, and they will not deduct your mark in those cases. For example, if it is a case of procedural counseling, it is a long scenario. If it is a case of explaining diagnosis to a patient and then telling about its treatment, then again it is a long scenario. Or it is a scenario that you have to tell about the condition to the surrogate or the patient, and you have to tell about the medical error. Again, it is a long scenario. So whenever social history is applicable, then you have to complete it in the ending, otherwise no. And also you will have to provide help in the form of leaflets, brochures, website address, as well as you will set a follow-up plan for the patient. You will give him a hospital contact number. You will involve the GP if it is applicable, then the support groups and the support societies according to the scenario, and multidisciplinary team involvement, social services or social help or financial help. And if it is applicable, then negotiate a management plan to the patient. And summarize in the end. For example, some candidates or some people say that okay, you can ask the patient to summarize the whole thing for you. But I have seen a few feedbacks of the candidates in which the examiner have wrote that summarize it yourself, or the doctor has summarized it for the patient. I mean, this is considered good in their feedback. So uh, you can say that okay, I can summarize it for you, that whatever we have talked, let me summarize it for you. And keep on asking concerns, that do you have any concern. Keep on asking this question, okay, so that you can get to know that yes, this concern part is at least completed. So let's come towards this scenario again. uh, After telling about the confidentiality and asking about the insight of the patient, you can ask, do you have any specific concerns for me today? Because sometimes they have given the surrogate the information that if the candidate asks from you any specific concern in the start, you will answer like this. For example, he may think that it is just a simple infection or it is tuberculosis or something like that. Okay, and this HIV and tuberculosis are just like siblings. So basically, you for example, like this, in this scenario it is not like this, but this scenario has come many times, like HIV patient having tuberculosis or something like that. Okay, so you will start that, okay, I appreciate your knowledge regarding your health condition, and yes, you are right that you came here to get the results of your test, and I am here with your reports, and I'm so sorry to tell you that I don't have a good news for you today. Your test results are not what we expected. Again, you will give a pause. Okay, just a pause of 1 to 2 seconds. Your body language, your eye contact, your face expressions, all is checked in the exam. Then you will say, unfortunately, you have come out positive for HIV. Okay, here you can use the term HIV instead of human immune, because mostly the doctors also get confused that, okay, human immunodeficiency virus, especially once they are quite senior, they use this. So here you can use this term HIV. Okay, then you will say, give a pause. After giving a pause, you will say, do you want me to continue? Yes, he will either give some concern, you will manage accordingly, or he will say, yes doctor, please continue. Then you will show some empathy, that I can see that this news has been a quite shock for you today, but we will try to provide you all the possible support and help in this regard. After that, instead of asking such question, for example, do you have any unprotected intercourse, instead of using this sexual intercourse, it is better to use the term intimate relationship. Okay, so you can say that instead of asking this question, you can ask a broad question, that had you ever thought about HIV, or HIV ever crossed your mind before, because of your lifestyle or risk of exposure of HIV infection. Just a diplomatic question, instead of using this question, that do you do any unprotected intimate relationship. Okay, and again, if you are talking about such a sensitive topic, you will keep on telling him that I am not trying to be judgmental here. Instead, I just want to give you the best possible treatment in this regard. And similarly, again, you can say that all of whatever you will tell me today will be kept confidential. Okay, and yes, you manage this quite well. That many people with HIV illness, they spend a reasonably good quality of life and lead a near normal life, and you will just need to be on the treatment for an extended period of time, and our treating team will keep you under monitoring. They will give you certain treatment, and they will monitor the response of that treatment. Okay, and after that, for example, if for example he was telling you uh, that please don't tell this thing to my wife, you will say that I reassure you that apart from the senior doctor and medical staff who is looking after your case, uh, at this moment nobody else has been informed about your test or about your report. But I would advise you that you should inform your wife regarding this, because it is very important. And here you because here you have to convince a patient, so try to add a few sentences, some emotional counseling of this patient. Here you can see that it is very important, because I think that you love your wife and you care about her, and you won't like her to suffer, and especially suffer your beloved wife because of you. And for example, if she will know about this news of you from a third party, she will not trust you in the future. For example, if you just add these sentences, then the patient will not say anything else, that, oh, no, no, doctor, I still need to think about it, or I will not tell her, or please don't inform her. Okay. And after that, yes, you will tell him that we will inform to your GP regarding your diagnosis, so that he can provide you better healthcare facilities regarding this. And also you will be assessed by the HIV specialist doctor as well as HIV specialist nurse. They will keep you under like regular follow up, they will start you on the treatment, and they will monitor your response to the treatment, and they will surely guide you in this regard. And if you and again, for example, if you have not touched that topic, that many people lead a quite normal life if they remain compliant to the therapy and keep himself under regular follow up with the doctors. Okay. And after that, yes, in the end, you will tell about not only leaflets, brochures, and website address, but also you will say that we will refer you to the sexual and reproductive health multidisciplinary team, and they will help you in this regard. They will be a source of help for you. And one thing more here, for example, in such cases of sexually transmitted infections uh, and also tuberculosis, here one thing else which they need you to touch in the communication cases is contact tracing. So here you will also include this thing in your communication, that we will also do contact tracing, and also encourage you to contact trace your previous partner or anyone with whom you might have shared needles, because they also need to be tested, and they also need to be treated in this regard. Okay.
Okay, okay. But Dr. Mubasha, in this case, he said that I have no other relationship with anyone or sharing of needles.
Yes, doctor, but still you need to do this thing. At least you need to touch this thing. Okay. And
Okay.
another thing is that, for example, if you haven't told the surrogate that we will keep your information confidential, again, he will become, somewhat protective about his answers. So
Okay.
basically, your main theme is that you have to tell this thing, contact tracing, whenever it is a communicable disease. Okay.
Okay,
Okay.
okay.
And again, for example, in this scenario, yes, you touch the topic of precautions and safety netting that avoid the sharp instruments, for example, razor, nail cutters. Also, you can tell that avoid giving any blood transfusion or any intimate relationship, even with your wife, without any barrier method. Okay. The rest you perform very well. Just these were a few points which I needed to tell. Any questions
No.
or any question from anybody else? I also want to tell you something, for example, somewhat introduction about this communication. Like, for example, just give me a second and let me share with you the mark sheet. The mark sheet basically which you have to fill in the exam for both of your communication stations. That when you will go on your exam day, you will be handed over 16 mark sheets. And I advise you to reach your exam center well in time, at least 30 minutes before, because you have not only to give your attendance over there, you will sign the form, you will check, they will check your identity either in the form of ID card or in the form of passport. uh, they will hand over you these 16 sheets, and they hand over almost 1 hour before, because these take quite a lot of time, that you have to fill these exam number as well as your roll number, exam venue, your name. uh, so it takes time, at least it takes 30 minutes. So it is better to reach the exam hall at least 1 hour or 45 minutes before. So this is the exam sheet. I'm not sure if you people are able to see it. You, if anyone is using mobile, they can zoom this. Here, actually, in the communication station, in the previous pattern, there was only one communication station that was almost 15 minutes with a surrogate and 5 minutes viva. But now it is only 10 minutes, and 10 minutes with the surrogate or the patient only. There is no viva, and they have added two communication stations for you. Here you can see in the mark sheet that your four skills are assessed in this station. Just familiarize yourself with the clinical mark sheet. For example, here your clinical communication skill will be checked, your clinical judgment will be checked, as well as managing patient concern and maintaining patient welfare. And you can see that what they basically want in each skill from you. Here basically they will give you marks according to three categories. Either it is satisfactory, borderline, or unsatisfactory. If it is satisfactory, you can get 4 marks in each skill. Hence, it will make 16 marks. If it is borderline in any, you will lose 2 marks. And if it is unsatisfactory, then 0 marks in that skill. One thing more I want to tell you here is that this is the beauty of paces, that for example, if you do not perform well in one station, just forget about it, because you don't have to pass each station, you have to pass the skill, and you have much margin available in the next stations. That for example, in any skill you get less marks, still you can get compensate those in the next stations. For example, if you cannot ask about the concerns in one station, just keep this focus that you don't have to miss this skill in the next stations. Okay. And
Okay.
you will be provided written instruction for the communication station, just like what we do here in the online class, that you will be handed over a scenario during the 5-minute interval before the station starts, and it can be a 1 page long. So try to read it quickly, because this paper will remain outside. They will just hand over you one more paper and a pencil, and on that paper, even before starting reading the scenario, just write the name of the patient and his age, and whether you have to talk with the patient or you have to talk with the surrogate. Most of the time it is okay, there is only one. Either he will be the patient himself or he will be the relative. So here you have to consider this, that what is the relation of the relative, or what is his name if it is given, and just write on that paper about your whole agenda. For example, you can write introduction, check identity, because in exam sometimes, because of the pressure of the exam, we can miss any step. So if that paper is in front of you, you can read it, and the examiners will not mind this. Okay. So you will write introduction, check identity, build repo, set agenda, and only 1 to 2 sentences. For example, just like this, that whether here I can say that do you want anyone else to be in this meeting today, or you can. Uh, for example, like this scenario where you don't have to ask such sentence, instead you will write that whatever we will talk about today will be kept confidential. Okay, just write this a few words so that you will remember this. After that, you can write ice. Ice means insight from the patient. C means concern from the patient. Even before starting explanation, E is basically explanation. You will do each and everything within 1 minute. I mean, before this opening time will be completed in 1 minute. After that, you will start explanation, and uh, okay, another thing is that, for example, here, when you will come inside the room for your communication station, there will be two examiners. One will be the leading examiner, and other will be the examiner. But both of them will give you marks separately, because for each station you have to fill two sheets. Okay, so each of the examiner will give you marks separately, and most of the time they count the average of both examiners. For example, if one examiner has given you 16 out of 16 and another examiner has given you 14 out of 16, so it may happen that you will get the average of those marks. But once the result will come, they will give you all the sheets in picture form. Okay, so that you can get to know that what one the leading examiner gave you marks and his remarks, and also the other examiner how much marks he has given you. Okay, so there are always some keys for a successful communication or successful exam or whatever station you are appearing, so that you can get full marks in these stations. For example, in this station of communication, always approach this station as a two-way discussion, two-way communication, rather than only the candidate is speaking and conveying lots of information to the surrogate in a lecture style. Because here there is no assessment of your knowledge. They already know that you know much about the um, whole medicine, but here they just want you to know that how you can communicate with the patient or the surrogate. So keep it two-sided conversation. keep on checking his understanding, keep on asking concerns. And for example, in such scenarios where you have to do a lot of communication, for example, like in procedural counseling, you have to give him a lot of information. So in those communication stations, you can ask that I hope I am not overloading you with lots of information, uh, just a few sentences. So keep him engaging during your conversation. Okay. And other thing is that familiarize yourself with new or controversial or somewhat a ration treatment or DVLA guidelines. And also, I will advise you to revise them 1 or 2 days before your exam. Instead, I would say revise them 2 days before your exam, because the last day, just keep calm, keep your nerves under, control. No need to study at least after a certain time, 4 to 5 p.m. After that, just close your books, just pray to Allah Almighty, and no need to panic at that time, because you all have worked hard. Whosoever is appearing in the exam, he has done his best. So this is the advice I want to give you, that just keep your calm nerves under control, just be confident, and just your natural style, just consider yourself that you are in hospital, and only thing is that here you are performing under supervision. Otherwise, all these things we perform in our daily basis. So uh, just this thing I wanted to tell you. And other important thing, yes, these basis examiners say that most of the examiners like that the candidate draw for the patient or the surrogate. For example, when you are outside in the exam hall, not only this thing that you will remember that whether what sentence I should start in my conversation with the patient, whether I will involve someone else from the family, or I will say that everything you will tell will be kept confidential. In the meantime, you can say that whether I can draw something here for the patient. For example, you can draw if it is a scenario of explaining a diagnosis to the patient, for example, in the form of autosomal dominant polycystic kidney disease, or somewhat counseling about pheochromocytoma. In that, you can say that okay, this is your kidney, this is your suprarenal gland, which are basically present over the kidney. These are like this, let me draw it for you. Just it will take your 10 to 20 seconds, but it leaves a very good impression on the examiner. And all of the things which you will write on that paper, you will hand over that to the examiner. And just in those 1 to 2 minutes when you are going outside of that room, your marks will be decided. And these few things leave a very good impression on the examiners. Okay. And also, I want to tell you here that in each communication station, there are some hidden issues or some key issues. Always try to identify the key issues whenever you are preparing for the exam, or you are. Now, for example, if such scenario came in your exam which you haven't prepared, just don't be panic. Just apply those formulas, that whether it is a case of breaking bad news, or it is a case of explaining diagnosis to a patient, or it is a procedural counseling, or I am dealing with the angry patient. Just apply those formulas. Just follow that guideline. Whenever you have been preparing this, this station, just apply those formulas, and you can perform any station, whether it is new or any past paper, or they come from any past paper. So, uh, just think this thing, na? And one thing more, for example, there can be some hidden agendas inside the scenario. For example, they will tell you that this patient has ultimately whatever the symptoms he will tell you, he will say he also has depression. Like for example, it is a case of multiple sclerosis, and patient has depression since a few years. So this is hidden agenda, although it is not included in your task, but still you need to tell at least 1 to 2 lines, that for example, how is the mood of your father or your brother, whatever the relation, or for example, if he is the patient himself, and he will say, yes, I am always in a low mood. Here you can ask that I will refer you to the mood doctor. Just this thing they need from you. Okay. And for example, there can be some driving issue. It is not your task, but still it is inside that thing. Or for example, if he is a smoker and it is not the counseling regarding smoking cessation, they have just mentioned it in the scenario. You need to address it when you are taking the social history in the end. Okay. And Yes, Dr. Faiza performed very well that whenever you are starting the scenario, I mean, you are checking the insight of the patient, just don't assume it yourself. Okay, always agree to the purpose of consultation. Never assume it yourself that yes, the candidate has already known. Yes, they have known. The surrogate are already known to the scenario. They have been I mean, up to the mark. The examiners have told them each and everything. But the examiners want from you that you agree the purpose of consultation with them, you set the agenda with them. So here you have to start with the open ended question. Always check the insight of the patient. For example, maybe he will say that yes, I was outside the clinic waiting for you, and some of the nurses told me that my HIV test has come out to be positive. Okay, so always check the insight of this patient, and keep on establishing the patient understanding, knowledge, and concern at any stage. Okay, especially at the early stage, you can ask. Okay, and facilitate your communication station by demonstrating empathy, provide some good words and some good sentences of reassurance. But here I want to tell you one thing, that never give any false hope or false promises, and try to avoid any specific timeline to the patient. And whenever you are outside the exam hall before the start of your station, think in mind about all the legal and ethical issues involved in this communication and apply it during your communication. Okay. Uh, and other thing is that, for example, whenever you are performing in the exam, your words, your voice, your tone, it should be very crystal clear, because examiners will just judge you from that. Here they will not take viva from you, so you have only those 10 minutes, and these 16 marks are in your head. And if you perform well, your tone of the voice is adequate, your posture, your body language, your eye contact. For example, you are nodding whenever the candidate is giving you information, and even you can smile at the end of the communication if it is applicable. It will lead a very good impression, and you can get 16 out of 16 marks in that scenario. And your empathetic behavior, I mean, your empathy, it counts a lot. Like you offer a tissue paper or a glass of water, and these golden pauses, these are very important in those communication cases where you are breaking the bad news to the patient. Okay. And again, I would say that don't try to dominate the discussion. Just keep on checking the understanding, keep it a two-way communication. Okay. And because few examiners do not like that the candidate is only speaking and the surrogate is not speaking, or the candidate is not giving much time for the surrogate to speak. All right. And I think just these things I needed to tell you. So just be confident, believe in yourself, adopt a holistic approach. I mean, involve each and every aspect of the scenario, not just a part of it, or just don't focus on your one task. Try to find the hidden agenda in that scenario, because sometimes there is more than one task. He can tell you, for example, here there was only one task, you have to explain the diagnosis of HIV. But in some scenarios there is more than one task. For example, if it is a case of motor neuron disease, not only you have to explain the diagnosis of motor neuron disease, but also you have to tell the future aspect of this diagnosis, or you have to do the procedural counseling along with it, for example, PEG tube insertion. So here there are more than one task. Okay. And another thing I want to tell you here, that whatever the communication case you get in your exam, there is no need to move away from your task. For example, no need to tell about other things which are not mentioned in the scenario. For example, if it is a scenario in which you have to explain to a patient about the diagnosis, and then you have to start warfarin for that patient. Here, apart from your knowledge, that for example, you know that for this condition now the guidelines say that NOACs are given, but your task is to tell about warfarin. So don't move away from your task. Here you will tell just about warfarin, even if the examiner have told the surrogate about this question, that there are some oral anticoagulants also available, or oral blood thinners. You will say that yes, I appreciate your knowledge regarding this, but This decision has been taken in the best interest of you. Here you will start warfarin. This decision has been taken up by our treating team. It is in the best interest of you. It is according to our local international guidelines, or whatever you can say your sentences. I just want to tell you here that just don't move away from your task, because they just want you to convey the information which has been given to you. No need to impart your own knowledge regarding, okay, nice guidelines say this or other guidelines say about this. Here you will just stick to your task. For example, if it is a case of end stage renal disease, and they have given you the task that do the explanation of renal transplant and discuss this case with him. Here, despite of the knowledge that you know that there are other renal replacement therapies available in the form of hemodialysis or peritoneal dialysis, but they haven't mentioned this in the scenario. They only ask you to tell the patient about renal transplant. So if they ask from you any other option available, you can say yes, there are other options available, but my task is to tell you about the renal transplant, and this decision has been taken in the best interest, and again the same sentences. So just try to be diplomatic. No need to answer in the form of yes or no. Stick to your task. No need to touch other things if the surrogate does not prompt you. Okay. And another very important thing, don't take each and everything on your own shoulders. Always involve multidisciplinary team, whether there is communication station or it is consultation station, or even when you are telling about the viva in your short cases. Always involve this multidisciplinary team, whether they are occupational health therapists, meals on wheel services, Macmillan nurses, whatever it is applicable. Okay. So this was all about which I wanted to tell you. Any question? Or you can write in the chat box. Okay, someone has written DVLA guidelines. I will share it in the group. When I was preparing for my exam, I just made a one paper so that it is easy to revise in the end. I will share that. Any question from anyone? If there is no question, then I will assume that all of you have understand whatever I was telling you about. Okay, people, I think there is no question. So thank you so much for joining. Best of luck. Stay blessed. Allah Hafiz.